live now. So what I'm going to do now is I'm going to add our guest for today. Guest on joining us. All right. How you doing, Tina?
I'm good. How are you?
Oh, fantastic. Well, once again, thank you for joining us today. And we'll give it another 30 seconds and we'll get started right at the top of the hour. I see we got some guests joining us.
Yeah.
Yeah, wonderful. Should be an exciting audience. Outstanding. So real quick, so what we'll do, we'll go ahead and get started. Just want to say good afternoon to everyone and welcome to the Allergy Insider. My name is Derrick Varner and I am one of the clinical educators with Thermo Fisher Scientific. I'm a physician assistant in San Antonio, Texas. And I will be your insider for the session of this series. Joining me today, I have an exciting guest. Her name is Tina Dominguez, who is the East Bay Clinical Director at Latitude Food Allergy Care and a fellow physician assistant in San Ramon, California. So before we start, just like to share, we should mention that this series and all episodes of Allergy Insider is intended to simply just discuss and surrounding evidence-based medicine and educational information about allergic conditions to help patients make more empowered and informed health decisions. But it is not, I would tell you, it is not intended to provide you any individual medical advice. We encourage you, all our listeners, that if you have any questions about that's pertinent to your own health history, we encourage you to discuss with your own personal health provider. Well, Tina, it is definitely summertime, and depending on where you're at in this country, there are children all over the world joining, maybe taking off from school, from college, traveling, going to different vacations, and what's happening is people are sometimes when they go on these trips, go on vacations, they may be a little challenged. Some may be even scared because of the fear of a food allergy and the impairment of their quality of life. And so because they have food allergies. So today we want to discuss food allergies and sensitivities, or is it just sensitivities? And during this episode, we're going to tackle those questions. So I would just let's dive right in, Tina. So my first question for you, Tina, is how does one define food allergy?
Simple answer. It is basically the immune system's way of overreacting to a food protein. And essentially that food protein for most is a harmless one. It's a protein that we get in most of our normal daily dietary needs. Most commonly, the things that will trigger a food allergy reaction, you always hear a reference of like the top 9. So milk, egg, peanuts, tree nuts, soy, fish, shellfish, and sesame. Sesame, I will say, is the newest to the group, but it's technically not the newest. Sesame is something that in my career over the 10 plus years that I have been doing any food allergy research or, working in private practice, I have always seen a lot of patients with a sesame allergy, and it finally has actually been added to all of the labeling laws and everything. So that's why it's now the new top 9. But, for the most part, these are foods that people can consume regularly and without issue. There are some that, essentially those proteins are poison to them.
Gotcha. Well, thank you so much. Tina, could you elaborate on that last food allergy, that sesame? Why is that so important nowadays?
So sesame really has, it's in baking, it's in breading on certain things, it's in breads, pastries. I mean, you name it, that sesame is something that surprises a lot of people as an ingredient. It's also one of those foods that's kind of an odd one. If you think about things like sesame seeds, they have a perfect little hole. When you're eating or consuming something sometimes with sesame, You have patients that will come to me and say, oh, I've had, sesame seed buns, or I've eaten sushi. And those typically are fine, but it's not until they really start to experience and explore new foods and get into different cultures and try hummus and things that contain tahini that they realize, uh-oh, sesame is not my friend. And that really is just because their body can tolerate either A, small amounts, or they've never truly had those seeds broken down when they do eat them. So
Yeah, thank you so much. Tina, let me ask you this question. What is, for our listening audience, what is the typical cause? What causes these food allergies? And is a genetic link to this food allergy?
This is probably the number one question that I get when I tell somebody, unfortunately, you have food allergies, or your child, they're like, well, what happened? What did I do wrong? I have 10 kids and only 2 of them have food allergies. All the pregnancies were the same. Honestly, we don't know what the specific link is. I don't think we'll ever have like one identifying factor that says this is the cause of food allergies. What we have noticed, and this is also true with like asthma and a couple other diseases, eczema, one of them, what we have seen is what we are doing from an environmental impact and standpoint is impacting how our epigenetics, those little building blocks to the DNA, really are changing the way that our immune system is building tolerance to it. So, we have companies like Coca-Cola, Pepsi, Nestle's. They used to make small products, and you used to be able to say, oh, here's their line of goods and services. But now you've got a plethora of things that they do. So I think it's our fast-paced and our convenience that is driving a lot of that too.
Gotcha. Well, thank you so much. Yes, that's the number one question that always comes up. Let me ask you this. What about how many people in the U.S. actually have or have experienced some type of food allergy?
Our number is roughly about 32 million that we always say within the US. I always say and counting because there's more people added to this. Essentially, it's about 1 in 10 adults or 1 in 13 children. But in truth, it's really hard to really estimate that actual number because, people are looking at how someone's diagnosed or ER visits and how they're coded too. So there's just some people that have it that have never been officially diagnosed too.
Yeah, good point. Let me ask you this. With that being said, the number of people been having that and it's growing. What are the typical signs and symptoms our patients, our viewers should be looking for that if one may start to experience a true allergy?
So true allergy is, if you have an allergic reaction, it's kind of one of those things where it may be instantaneously, or it may take a little bit of time. So you can see somebody can start to have abdominal pain. They may have some hives, shortness of breath. You may be able to physically hear wheezing. They may begin to cough. If their voice starts to sound funny, those are kind of all things that you can see. Sometimes you can see vomiting. The more severe symptoms tend to be shortness of breath, that kind of feeling like they have that impending doom, or they're really struggling to breathe. They start to look very pale. There could be drops in blood pressure, changes in heart rate and whatnot too.
Now, Tina, with that being said, that's for the food allergy patients. What about those patients, the typical signs and symptoms that they may have if they have a food sensitivity? Typical signs.
Some can be similar. So sensitivity and intolerance kind of are roughly about the same. When you have a sensitivity, the most common symptoms that I've actually heard from patients are, I have belly pain. It tends to last for a while. If I eat something that triggers a sensitivity, I either have abdominal pain for the next 24, 48 hours, or it's ongoing, or they have bouts of diarrhea. You can also have like brain fog, headaches. The most common, I think, besides the abdominal pain is, oh, I ate something and my skin is flaring. I'm getting rashes too. Even body aches sometimes. It can be like flu-like symptoms, I guess you could say.
Got it. Yeah, that's a good one. That's a good point. Let me ask you this. What are some of those other type of reactions to foods that are different, that's not IgE mediated, that people may present with that we should be on the lookout for?
So there are a few that really, really can be confused with food allergy. And By far the number one that I actually see with a lot of infants. At Latitude, we get referred a lot of littles that have a history of eczema. General rule of thumb, if you look at if there's an infant or a family history of food allergies or eczema, and you have a little that has eczema, sometimes the pediatrician will recommend testing or an evaluation before they introduce any foods. And there have been a few patients that I've seen over the last few years that will come and say, we introduced egg for the very first time, and there was this very profuse, voluminous, almost like exorcism type vomiting, okay? Automatically someone says, oh, they must be allergic, and they send them to us. When you're talking to them and diving a little bit more in the history, it could be allergy, but usually more often than not, it is something that's called FPIES. So FPIES is a form of an allergy, more so of an intolerance. It's basically a food protein induced enterocolitis. So same thing, the protein is triggering the reaction and the protein is not your friend. But with FPIES, the timeline is a little bit different. There's particular foods that trigger it. The other common one that I get from especially a lot of like teens and adults is lactose intolerance. They'll come in thinking that they've developed this allergy to milk, and really it's just their body hasn't been able to break down the lactose too. There's a couple others generally that you will see: celiac disease, so not to be confused with wheat allergy. Celiac disease is typically, it's an autoimmune disease that patients just really cannot digest and process gluten, and it actually does damage to the intestines. So if you think about all of these are things that have reactions or symptoms that tend to last for quite some time. IBS is another one. It's a GI disorder that you can have diarrhea or constipation with.
Got it. Yeah, that's great. Yeah, and because of those symptoms, those conditions have those overlapping symptoms. Sometimes they can be confusing to the providers and also the patients. And now patients are very intelligent; they have access to more information than we have. So let's talk about some of those tests that they have access to, right? Because they have Miss Siri, Dr. Google, they have Amazon for the test on. But what's some of those tests that and we know that there's no 100% test result, but could you just share some of the things that we should be aware of when we're testing?
So, and I think a lot of people have seen all of these ads for food sensitivity testing, all of the DNA kits, you can swab anything and send it somewhere to get results now for anything nowadays. You could even do it for your pet. So most of the time what you're going to see is you're going to have someone that's going to be talking about like a food sensitivity kit or what's called a basophil activation test. Basophil activation tests, I've used those in research. They're definitely not ready for prime time. The results don't tend to align with what we're doing in like the allergy community as a whole. But the main thing I think to kind of point out, especially with the at-home kits that everybody keeps seeing the ads for, is not only is it online that you can get kits, but now there's a lot of commercial labs that are offering a lot of this. If you are looking at testing and it's not something that you have a provider or some type of, even a nurse, going through the results and deciphering those results for you, probably not the best idea. But also the thing to kind of keep in the back of your mind is these tests are looking at different antibodies within the body. So the vast majority of them are actually going to look at IgG. IgG is different from IgE. IgE is usually responsible and can tell us about food allergies. IgG it's an amazing antibody. It's the most common one in the body, and it simply just tells you you've been exposed to something and you're tolerant to it. It doesn't really provide much data other than that. So it doesn't really say you are sensitive to this food because your number is high. It just means maybe that's a food that you eat commonly or that you're exposed to all the time.
Gotcha. Well, thank you for clarifying that, because I think that's out there, right? Between IgE, that's really the test of choice, the blood test of choice to help make the aid in the diagnosis of allergy or atopic diseases. Let me ask you this, Tina. With that being said, what does the guidelines say about the appropriateness of making the diagnosis of a food allergy? What can our patients and listeners out there expect from their primary care providers, or if they are referred to an allergist, what should they be thinking about?
So typically you'll have a patient that will have an ER event. If it's a young child that may have never had a history of it, they end up in the ER and referred to allergy or the pediatrician. What you really want to hope for, and this is, this is where we know as clinicians that the history is what guides you on everything. I will be honest, and a lot of food allergy parents are already aware of this, that our testing in the allergy realm is not the greatest. It's sensitive, but it's not very specific to say, yes, this is allergy, or no, it's not, or even if it's allergy, what the eliciting, like triggering amount would be. You want your provider to sit down and really take a good history. For patients, it is important to know what food you ate. Even if you're like, I don't know what the trigger was, just give them an idea of what the meal was or the quantity that was eaten, because that helps us. But taking a really good history, looking at not only the history for that particular event, but history overall, and getting a good background on everything. Family history can be helpful. That will guide your provider in, it'll help them essentially decide, do we do testing? Is it necessary? Or is this maybe some type of intolerance or sensitivity, or, was it something else? But oftentimes I get families that will come in here and they will be introducing foods, and especially this year in particular with all of the viruses, you'll have somebody that has maybe viral induced hives. As a parent, that's scary. You don't know what those hives are for. You have a child that clearly can't tell you what's going on or how they're feeling because they're too little. And then oftentimes they end up, coming to see the allergist. In cases like that, where you can pinpoint certain things, where the hives have last days on end, that is not something that would warrant testing. So getting that good history and looking at the timeline is one of the key elements. If there are things that guide you towards this is potentially food allergy, you're most likely, if you're a pediatrician, they're going to refer you to an allergist. The allergist or the allergy provider is going to provide blood testing and skin testing most likely. And sometimes if they suspect that maybe the food wasn't a true allergy or a trigger for it, they would do what's called an oral challenge. And that's technically the gold standard test.
Yeah. So the gold standard. Let me ask you this. When those patients do test positive for a skin prick or a specific IgE blood test, they're wondering, I'm having I got this positive test, but I don't have any symptoms. Could you touch on that a little bit about the sensitivity component?
So the testing is really just designed to say, could there be an allergy? And everyone will look at their lab values, whether it's the blood test or skin test, and say, wow, my number's high. It's relative. So, when you look at somebody, you can have a child that has an IgE that's in the 2 or 3s, and a parent will say, wow, that's really high. When I look at it, I know from my experience that that number's not too bad. It's actually either A, is it true? If it's true allergy, depending on the age of the child, there's a possibility they could still outgrow it. Or if it is high, and maybe the skin testing is elevated too, that could potentially still indicate allergy. But when we're looking at the blood test and the skin test, we can always reference as providers and look and see not only our own personal experience with food challenges, but looking at all of the data that's been published, and say, if you have a lab value of, under this number and a skin test under this number, that would potentially warrant a food challenge. Because again, that food challenge is really going to be the thing that says yes or no allergy. And they're done for different reasons. In clinical trials, we do them to prove an allergy exists. In the private sector of allergy, we do it to prove that an allergy doesn't exist.
Yeah, because you're right. Sometimes we're quick to blame, right, a food for particular sensitivity or intolerance or whatever the case may be. So let me ask you this, Tina. When it comes to the food challenges, I know some listeners out there, are they really safe? Are they safe to do? And if you, I'm not sure if you have this, but what percentage of the time patients may experience a reaction? Because, when you're telling me there's a potential, what does that look like, right? Walk us through.
So I always tell patients, this is my best guess as of, do I think this is allergy or not? And it's honestly, that's one of the best ways to put it, because again, we're looking at these data points and trying to determine, is this allergy or not? When you look at a lot of the literature, even here at Latitude, our passing rate for food challenges is usually like 80 to 85%. It is a very nerve-wracking day. It's a very scary day for some people. Anxiety is high. I always ask patients, like, how are we feeling today? Are we nervous and excited? And usually I get a yes. And when I don't get it, I'm like, okay, what's going on? Are we just a little too? But you know, some challenges have higher rates of reaction just simply because of the type of food. Typically, my personal experience, baked milk and baked egg challenges are always, you can rely on the labs, but again, it's when they physically ingest it, that is the true test of it. So we tend to see higher rates of reactions, higher rates of epi use with challenges like that. But for the most part, your provider is not going to recommend, again, unless this is research, they're not going to recommend doing a food challenge if they think it's going to cause a severe reaction. You know, there's no value in knowing, you know, how sensitive somebody is to a food if, you know, we just know that it's an allergy already. And again, you know, from a research standpoint, absolutely necessary. We need to know starting, finish, you know, starting point of how reactive are you to where you get to the end if you go through a trial and treatment. But for private practice, if we're saying this is challengeable, I would say about 82% to 85% are going to pass that. We actually do different types of challenges here at Latitude. So if I do think that somebody is allergic to a food, but maybe they have this really, really crazy high tolerance, we can test that theory and see like where they react to. And there's a particular reason and goal in mind when we're doing that.
That's good to know. Tina, let me ask you this. And I'm pretty sure this is on thousands of minds here. Does the food allergy, just two-part question, does food allergies really go away? And can one develop a food allergy at some point in their lifetime?
So those are the two questions I get next after the why. Well, this is going to go away. Yes, and no, and no. So food allergies can go away for some people. And this is something that we actually see. And one of the reasons why it is best that if you do suspect a food allergy in a young child, it is best to get evaluated for, because we can help you determine based on the blood test, the skin test, and the history, what that likelihood of them outgrowing their allergy is or not. Most commonly, milk and egg are the two foods that children will tend to outgrow. The cool thing actually about a milk and an egg allergy, if there's ever anything cool about it, is most of those kids, about 70% of them, can actually tolerate some form of a baked egg or baked milk. So that is usually a good sign, and that's actually a good starting point on helping them to outgrow that allergy by introducing some of those things. So that's why those are, you know, foods challenges that are often done in clinics. More often than not, peanut and tree nuts are things that if the lab values are at certain levels or certain thresholds, it's unlikely that they're going to outgrow it. About 20% of kids will outgrow a peanut or tree nut, and only 5% will outgrow fish or shellfish. So, you know, in general, we say if somebody hasn't lost an allergy by age 16 or 17, the allergy really is kind of there to stay. On the flip side of that, you can have no allergies all of your life and all of a sudden go out to dinner and have a shrimp dinner or a crab dinner, and all of a sudden you look like Hitch in the movie, and your face is swollen, and your lip is swollen, and you're talking like this, and everyone at the dinner table is going, whoa. It is very, very common that fish and shellfish, particularly shellfish, is developed later on in life. So that is, I do see a lot of adults that will come in and say, I've been an avid seafood eater all my life. Obviously, I don't eat it every week or every day. I'm not like, you know, fine dining on crab and lobster. But went to dinner and all of a sudden I was having issues breathing. I was having facial swelling. My tongue started to swell. Unfortunately for them, they most likely have developed a shellfish allergy or a fish allergy.
Wow, yeah, that's amazing. You go from enjoying a certain food and all of a sudden that food becomes an enemy of your immune system and you can't enjoy it anymore. So that really is life-changing. Let me ask you this, Tina. When you do go about identifying those food allergies, those patients, what type of treatment plans do you typically offer or suggest and manage for different age groups? What does that look like?
So there's a couple of different things based on history testing. Sometimes if we're talking about like a 6-month-old infant, we will essentially say, we need to see multiple data points before we can kind of determine, are they going to outgrow this? Is this an allergy here to stay? So avoidance sometimes is one thing that we'll talk about with families. There are a couple of different treatment options. There was the FDA approved drug Palforzia that can help treat peanut allergy for age of 4 to 17. That has kind of opened the gateway and the doorway to allow other treatments from the research setting. But, you know, there are a lot of allergists that are really looking at everyone's allergies and beginning to say, like, you know, we're seeing great results and have seen great results in research with the oral immunotherapy and desensitization. So that's something that you can talk to your provider with and say, you know, have a good sit down conversation and say, what does it entail? You know, what do I need to do? What does the commitment look like? Is this right for my family? Is it right for me? We offer oral immunotherapy at Latitude. And, you know, the cool thing about doing this in a private allergy setting versus a research is very black and white. You have to follow the protocol. A lot of people don't follow and, you know, hit those little perfect check boxes. We can actually tailor a lot of what we do for treatment for patients too. In terms of like the littles that may have the eczema or even FPIES or things like that, we still track and, you know, give them ideas of what to do and help them kind of figure out where do you go with that allergy to, or, you know, whatever intolerance it is. We actually also have a nutritionist on staff. So usually if you see an allergy provider and they feel like this is an intolerance or a sensitivity, and I think right now everyone is talking about gluten sensitivity or intolerance. If they suspect that, getting a GI referral is one thing that is usually a good idea. And then talking to a nutritionist and kind of looking at your diet, because sometimes you're eating things that you don't really realize may be a trigger or a cause of some of your symptoms too. So, you know, you really want to look at and meet with somebody that can offer some tailored therapy. In the research realm, there's a lot of cool stuff that is going to be coming down the pipeline. You will have drugs that are going to be coming out, biologics that are already on the market for treatment of maybe like asthma or EOE or certain things, or eczema, that are going to be either solo therapy or adjunct therapy with like some type of desensitization too. With any luck, we will see a peanut patch via skin come out in the next year or two, which will be great. Sublingual therapy. I mean, there's a lot of different things and conversations you can have with your allergy provider.
Wow, that's amazing what's on the horizon and what's taking place. Thank you, Tina, for sharing with the patients some of those strategies that patients that are living with food allergies and with the audience today, because I think it's really going to be helpful as we move forward in this summer month, right? And in this wind, and even beyond the summertime. So we appreciate that. We'll just see
Having me.
Chat real quick. And it may not be anything, and if there's not, let me just see here. I didn't see anything in the chat. So with that being said, I just want to say thank you, Tina, and thank you, everybody, for joining us today. Let's see. No questions at this time. So, Tina, with that being said, since there's no questions, that means that you answered everything. You were able to read. You answered all the questions that our viewing audience had today. So we just want to thank you for that. So to close it out, we have one more piece of exciting information or announcement to make. In our partnership with FAIR, join us for a live webinar at the end of this month. It's going to be focused on Food Allergy 101, food allergy testing basics, food allergy testing basics. This webinar will take place on June the 28th at 1 p.m. Eastern Time, and you can feel free to register at the link. And please also like us, share this, make comments to this video, and follow us on the Allergy Insider. So once again, we thank you for joining us. See you next time.
Have a good afternoon. Thank you, guys.
Take care.